So in terms of mental health outcomes, and in the rest of the presentation, I use the word disaster to cover mass trauma, just as a heads up. What research has shown is that disasters are associated with trauma-related disorders. So these are disorders for which an exposure to a traumatic event is a prerequisite, including acute stress disorder or reactions within the first month and PTSD, but also other psychiatric conditions for which trauma is not a prerequisite. So conditions like major depressive disorder, generalized anxiety disorder, and substance use disorder, as well as elevated rates of other clinically relevant phenomena that don't necessarily map neatly onto psychiatric diagnoses, such as generalized psychological distress, internalizing or mood anxiety disorder, mood anxiety symptoms, and externalizing or conduct behavioral symptoms in children, suicidality, as well as negative health behaviors such as binge eating, substance use that doesn't meet criteria for substance use disorder, sedentary behaviors, so on and so forth. We also know that, unfortunately, the mental health effects of mass trauma for some people persist and are chronic. So this graph here is from a study that I've been a part of that has included low-income mothers from prior to Hurricane Katrina to 1, 5, and 12 years thereafter. And the punchline here is that even 12 years after the hurricane, rates of serious mental illness and psychological distress remain elevated as compared to prior to the disaster. And 1 in 6 of our participants still had symptoms consistent with PTSD. So this is to say, you know, certainly there are mental health conditions that persist over time, but not everyone is going to be affected in the same way.